George Clooney is known for his classic Hollywood looks and undeniable charm, but over the years fans have noticed some subtle changes in his appearance. Has the A-list actor turned to plastic surgery to maintain his looks? Or is it just the magic of good genes and smart grooming? Estimated costs of potential procedures are provided at the end, so make sure to stick around. In 1980, at the age of 19, you can see that George already has some forehead rhytids or wrinkles. These can form fairly early, and usually they start off as just dynamic wrinkles with facial animation, and then eventually they become a more static type of wrinkle where you see them at rest. George also has very thick scalp hair and thick eyebrow hair, and he has a widow's peak, which is that projection at the center of the hairline. George also has orbicularis oculi prominence of the lower eyelid. And believe it or not, but some people are actually getting fillers into that area in order to give themselves the appearance that George naturally has. And George has his characteristic prominent chin. In 1985, at the age of 24, George has some upper eyelid hooding, where you can only see the tarsal platform when he elevates his brows. And George has a relatively thin upper lip. George also is right side dominant, so I often talk about how our faces are asymmetrical. We usually have one side that's a bit stronger, a bit bigger than the other side. So when you look at George Clooney's face, you can see that his right side is a bit larger, it's a bit wider. And the muscles on the right side of his face appear to pull a bit stronger than on the left. And also the right side of his chin is a bit lower than the left. And that's because the bone is actually shaped differently and is a bit bigger on the right compared to the left. In 1986, at the age of 25, what we can notice here is the location of his temple hair. There is good vertical alignment between where the temple hair is and where the tail of the brow ends. When people come to me for a hair transplant and I'm looking to design their temples, these are the types of facial landmarks that I'm using and taking into consideration when completing that design. You don't want the temple to sit too close to the center of your face because that creates too small of a forehead and then something just feels unnatural. George also has full upper tooth show on smile. In 1987, at the age of 26, I see no change. In 1988, at the age of 27, we can see some increased frontotemporal recession. It's still very minor, and overall, George has maintained quite a youthful hairline. But remember that decade between about 25 to 35 years old is when most guys will notice accelerated hair loss. And sometimes it can catch you off guard because people aren't paying attention to it, and before they know it, the hair has thinned out considerably. And sometimes there's very pronounced recession or even crown loss as well. And by the time people notice it, it's sometimes too late to bring a lot of that hair back. Because remember, even with a hair transplant, there's a limited number of grafts that we can transplant in a single session or over the course of many sessions. And sometimes it's not enough to replenish everything that was lost. So the best thing to do is always to prevent the hair loss in the first place. In 1989, at the age of 28, what we see here is some crowding around George's eyes. And this is due to a number of factors. The first is that he has low, full brows, and that creates almost a heaviness over the eye area. The second is dermatochalasis, or redundant tissue of the upper eyelid. The third is lower lid muscle prominence, and we talked about that earlier, where he has that slight fullness of his lower eyelid. And that almost pushes up on the eye itself, giving it a more crowded appearance. And the fourth is that his lateral canthus sits at a slightly lower level than his medial canthus, and that trajectory is accentuated by the position and the contour of the eyebrow itself, especially as the tail of the brow starts to descend down. In 1990, at the age of 29, we're seeing some infraorbital hollowing, and that's that area between the lower eyelid and the cheek that's starting to hollow out, and the skin in that area is quite thin, so as we lose volume and as our face starts to descend, that transition point between the lid-cheek junction becomes more obvious. Also, George has moderate philtral length, and he has some upper tooth show on repose, meaning when he just parts his lips. I've noticed in my practice, and my colleagues have as well, that more men are starting to get interested in lip lift surgery. But one of the parameters that we have to be careful of when considering a lip lift is the upper tooth show, especially if it's present at baseline. As we do the lip lifting lifting, the lip will go up, and so the upper teeth will become more exposed. So if you have no tooth show or just a little bit of tooth show, that can be sometimes a good thing. But if you have a lot of tooth show to start with, then that could potentially distort the anatomy too much. Also, a lip lift for men has to be done very carefully not to feminize the appearance of the area, because we know that with a lip lift, there's increased arch to the upper lip. And as you increase the arch, sometimes it can take on a more feminine appearance. In 1992, at the age of 31, I'm noticing that George's eyes appear more open when he elevates his brows, and you can see how he's elevating the brows based on the depth of his forehead wrinkles. And George has that really nice thick hair, and maybe that's just solely genetics, but it's also possible that he may have been started on finasteride around this time. Remember that finasteride was first approved for BPH in 1992, and then later approved for hair loss in 1997. But we know that in Hollywood, they can often get their hands on stuff before the rest of us do. And for people interested in obtaining finasteride, feelconfident.com is becoming a very popular place for people to go and get affordable finasteride delivered directly to their home. In 1993, at the age of 32, what I'm noticing here is that George's forehead height has increased as his hairline has pushed back, though his frontotemporal corners remain intact. And that's sometimes what we see. It's not always that the frontotemporal corners will recede back. Sometimes just the entire hairline comes up as we get into our 30s and beyond. And in 1994, at the age of 33, I see no change, and that's the same through 2014. In 2015, at the age of 54, I am seeing some signs of a potential brow lift. It does appear subtle. It took me several comparisons of pictures of George from when he was younger to more recent times. And then I went back in time to see when do I first notice that change. But to me, what gives it away is that increased distance between the bottom of his eyebrow and the upper eyelid margin. That distance has increased over time, which is not usually what happens naturally. And more people are starting to get these lateral brow lifts, and that can be done through an endoscopic approach. It can be done through a direct incisional approach here as well. But I think that George probably had a more global lift to his eyebrows, not just the lateral tail portion of it. And I don't think that this was done through a direct type of approach where the incision is placed right at the top of the eyebrow itself, or sometimes through a mid-forehead type of approach using one of the wrinkles. I don't think George would have risked that type of scarring. So instead, it was likely incisions that were placed behind the hairline, and those incisions used to dissect down to the eyebrow, releasing those attachments and repositioning it into a higher, more lifted position. Remember that sometimes brow lifts are combined with blepharoplasties or eyelid skin removal procedures. In this case, I don't think that George had an upper blepharoplasty because that skin still seems a bit redundant to me. But as we lift the brows, you already get some reduction of that redundancy. Sometimes you can add a blepharoplasty on top of that, but that's not always needed. And again, by avoiding the upper blepharoplasty, you avoid having an incision that could potentially be visible. So I think even if George did have a brow lift, it was done tastefully. But a lot of guys are scared of brow lifts because they don't want to be left with that surprise type of appearance and that artificial look. Think Mickey Rourke. What's interesting is that in 2015, George Clooney had an interview with the BBC where they asked him about plastic surgery and what his thoughts are on that topic. And he said, "I've seen it happen, particularly on men. I don't think it really works. I think it actually makes you look older. I'm a big believer in the idea that you can't try to look younger. You just have to look the best you can at the age you are." Looking age appropriate is definitely something that we discuss in plastic surgery and on this channel. But many people do turn to procedures to look their best. And I don't think that it necessarily makes you look older. You can look age appropriate with or without about cosmetic procedures. What do you think about what George said? Let me know in the comments below. In 2016, at the age of 55, I see no change. In 2017, at the age of 56, what I see is that George may have started to get some cheek filler around this time. When you compare back to an image of him from say 2008, what you'll notice is that he used to have a flatter midface and more infraorbital hollowing. And now that infraorbital area appears to be more filled, and the medial cheek in particular seems to be fuller. When fillers are performed into this area, sometimes you can just target the actual cheek in order to get some improvements in the lower eyelid, and other times the lower eyelid is addressed directly. But because the skin is so thin in that zone, you have to be very careful not to get what's called a Tyndall effect, where you can see that bluish type of hue from the filler, or a lot of swelling that can occur in the lower eyelid area from repeated injections of filler, or even just getting it once if too much volume was injected. And when I think about the possible brow lift and the cheek filler, I'm starting to think of someone else that I covered in the past. Brad Pitt? Interesting. And in 2018, at the age of 57, I see no change, and that's the same through 2023. And in 2024, at the age of 63, when we look at George's hairline, especially in the center, we're seeing some additional thinning, which is very normal. Even for people who are on finasteride for decades, they will still usually experience some thinning of the hair. And that's because as we age, just like the rest of our bodies, there's some structural loss to the hair itself. So even if you can maintain most of your follicles, there's some thinning, some depreciation in the caliber of the hair that does occur. But even so, George has an incredible fullness to his hair, and his hairline still sits in a very youthful position. And the total cost of these potential procedures is $45,000. What do you think about George Clooney's transformation? Are his looks all natural, or has he had some help from plastic surgery over the years? Let me know what you think in the comments below, and who should we cover next for another plastic surgery analysis. And if you haven't already, please subscribe to this channel. Thank you!